picked pediatric gastroenterology rather than adult gastroenterology just because I wanted to really give a chance to give a voice and support to a younger patient population. And the reason I've been so driven with the clinical care, with the research, what I do in advocacy, is I saw a young woman almost die from her disease because folks didn't really listen. But I always tell families, before I even get started, first, I just want to introduce myself not only to the family, but more importantly, the child or teen who's there. Because I always say that a child or teen should not feel that we're talking about them or at them, but with them. So they have to be that primary sort of person. And then I'd like to review what I've seen in the prior records and confirm with the families that that's correct, and then get the other details. And then after that, we talk about what's been ongoing, what brings them there to the visit, and what they're hoping, that I know, so that then we can come up with a game plan. So that first visit is to get all the information, come up with a game plan, and start some basic treatments, whether it be medication, whether it be dietary changes, whether it's getting other consultants involved, so that we can really approach things sort of as a team. And it's also just incorporating the key person, and that's the child or teen or young adult who is actually at that visit, right? And then I always tell families, I'm going to address, the patient first, but it's not that I'm trying to ignore the other family members, but I want to really hear from them. At the same time, though, parents know their child the best, so we want to get feedback from all the family members. But I'd like to at least try to address the patient first, so that we can have some of that discussion and understand what their goals are and how their body's feeling. The most rewarding part is seeing someone better, seeing someone smile, finding out that they're able to do the activities of daily life that they weren't able to do. Just look and know that you've got a team of folks waiting behind the clinic doors, waiting for you, whether you're in the hospital ward or the outpatient pods. And remember that the fancy buildings are there so that we can have the people and the resources. But at the end of the day, you want to make sure, whoever you see, that they treat you and listen to you as that person that really deserves to feel better, to understand the processes going on. And if you feel that you've made that relationship with whoever happens to be on your team, then you know that you're at the right place.